So let's kick things off. I know you have to leave early, so we've rearranged the schedule to have Adrian front loaded into the agenda. So Adrian Beck, do you want to bring us any update on the wildfire season or anything else that you want to share?
Thanks, Commissioner, and thank you also for allowing the pivot to the agenda this evening. So I'm Adrian Beck with the Director of the Missoula Office of Emergency Management, and tonight I thought I'd just give you a brief update on the fire season, or kind of the fire season that hasn't been for Missoula County specifically. Of course, we've been dealing with smoke from many fires in Washington, Oregon, Idaho, and California throughout this entire summer, but we've had a relatively unremarkable fire season for Missoula County, which is a good. Recent precipitation has reduced our fire danger rather to high fire danger, which is where we are today. And here's the scoop. Tomorrow at the Commissioners' admin meeting, we will be asking the commissioners to formally rescind the stage 2 fire restrictions that currently are in effect for private property in Missoula County outside of the city, all the way down to no restrictions. So campfires will once again be legal. You can mow your lawn with ease after 1 p.m. and all that essential firewood activity that typically comes with the fall can resume. We have had some situations where we've had evacuation warnings in place for fires that have posed some threat to private property, but I'm happy to report today that all of those evacuation warnings have been rescinded, as those fires are in really good shape as a result of the recent precipitation that we've had. I'd be happy to answer any questions about fire season generally. I would say that we're not quite out of the woods yet. We still do have an emergency proclamation in place for potential for wildfire emergencies that could emerge. We still have quite a bit of fire season ahead of us, but this recent precipitation really has kind of taken the wind out of the sails, and we're feeling really comfortable going into fall.
Great, thanks, Adrian. So any questions for Adrian on the fire season or anything else? Okay.
Looks like you have your hand up.
Oh, who is that?
Can you guys hear me?
Yeah, go ahead. Yeah, go ahead, Lee.
This is Lee. Yeah, thank you. This is Lee Bridges, and my question is, does that lift the permit burning on private property? Like if you have any brush piles or anything that you need to burn, does that lift on that, or is that still in place?
That's an excellent question, Lee, and thank you for having me mention that. So open burning by permit still remains closed because we are in high fire danger, and that is not a permitted activity. As we go into the fall and after we receive what we typically refer to as season ending event precipitation or cooler temperatures, then the fall open burning season will resume by permit. But right now, open burning is still closed.
Okay, thank you very much.
Thanks, Lee. Other questions for Adrian? Okay. Well, thanks, Adrian, for joining us. We'll kick you free for the evening.
Thank you very much. And again, thanks for the pivot to the agenda tonight. And it's just a reminder what we always talk about, whether it's fire season or flood season or anything else. Just encourage everyone and your constituents to register for Smart 911 so that you're able to receive emergency alerts that are actionable for your specific location. Thanks, everybody.
Thanks, Adrian.
Thanks, Adrian.
Thanks, Adrian.
Okay, moving on to the health department. Cindy Farr.
Hi, everybody. So I am going to share my screen, and I'll just kind of run through kind of some of the data that we're seeing right now. So this is today's data dashboard. This is on our MissoulaInfo.com website, and I just took some screenshots and popped it onto a Word document so I could show it to you guys. You can see from these graphs right here, we are definitely in the midst of a pretty intense spike right now. This little graph down here is showing the variation in age ranges. So right now we are seeing a bit more in this 0 to 19 age category than we've been seeing. And otherwise, it's pretty equally dispersed among all of us that are between the ages of 20 and 70. So you can see that. This graph right here is the one that is showing us where our goal level is. We're clearly pretty far above that level at this point. This is also on our dashboard, and this is showing hospitalizations, COVID hospitalizations. You can see from this graph, we are about equal to where we were in the middle of October last year when we were experiencing that big spike in hospitalizations. So this is highly concerning. We're definitely, our hospitals are letting us know that they are feeling the burden of COVID in Missoula County. And so, you know, I know that St. Patrick Hospital mentioned on the Board of Health, the special Board of Health meeting earlier this week, that they have had to put a pause on elective procedures at this time because they are definitely feeling the burden, and they are very much like us at the health department experiencing staffing shortages. Right now, we've got about 80 open positions in COVID work at the health department, and we're just really struggling to get people to fill those positions at this point. We are actively, you know, staffing up to try to get those positions filled, but, you know, we're getting about 20 people a week. So if anybody knows anyone looking for a job, definitely our jobs are all posted on Indeed, and they're also posted on the MissoulaInfo.com website. This is the total percentage of the total population that's fully vaccinated for COVID at this point. It's only down at 54.62%. As you can see, this is pretty far below our long-term goal of 75% vaccination. So we would really like to see that number come up. Right now, our average daily new cases per 100,000 people in the past 7 days is 46, and that number has gone up almost daily. So we are in the middle of a spike. We're past the tipping point where this is considered community-wide spread. And so what we are recommending for people is, you know, to go back to the basics. Now that we're dealing with the Delta variant, this is a whole game changer at this point. It is much more contagious. Younger people are getting more sick with it. So we're still trying to encourage vaccinations, but we are seeing a pretty substantial spread in Missoula County right now. So we're telling everyone, you know, that you need to keep your social circles small. One of the reasons that we're about 4 days behind on contact tracing is that most of our cases at this point are having around 20 close contacts per case. At this time last year, we were seeing roughly 6 to 10 close contacts per case. And so we're asking people to really think about who is in your social circle and trying to keep your social circles smaller. You know, frequent hand washing and sanitization of surfaces, wearing a mask, whether you're vaccinated or not, whenever you're out in public. Social distancing whenever you're around people outside of your own household, and getting tested at the first sign of symptoms. That's another trend that we have seen is people are getting tested much later or not at all. We're hearing anecdotally that somebody says, oh, well, I'm pretty sure that I had COVID, but I didn't get tested. I just figured I'd, you know, ride it out and get through it. And we still are encouraging people to get tested so that we can then quarantine your close contacts so that they're not getting sick and then going out and spreading it in the community. So that is the presentation that I have, and I'm happy to answer any questions.
Cindy, just to break the ice here, so would you characterize the folks who are taking up room in the hospitals? Are these by and large folks who have not been vaccinated who are getting COVID?
Yes, that's correct. It's primarily people who have not been vaccinated.
Okay, get vaccinated, folks. Bert.
Yeah, I had a follow-up on that. That was the question I was going to ask. Now I got a follow-up question from your 20+ contacts per person that's tested positive, how many of those are non-vaccinated? What percentage?
You know, I would say that it's pretty much in line. I don't have the exact percentage, but it's, you know, pretty much in line with what we are seeing as far as vaccinations in the community. It's about half and half. And right now we are following CDC guidelines for quarantine. And that was something that was voted on at the Special Board of Health meeting on Tuesday, is that there was some question about whether or not it was in conflict with House Bill 702, and should we keep following CDC guidelines and saying that people that are vaccinated that are close contacts do not have to quarantine, but people who are unvaccinated do. And the Board of Health voted to continue to follow that CDC guidance. And so right now in Missoula County, if you are a vaccinated close contact, then it's not necessary for you to quarantine as long as you remain asymptomatic for the full 14 days after exposure. But if you are unvaccinated, then you are still required to quarantine.
Yeah, thank you very much. That was a complete answer. And I had a couple of more thoughts on that, and maybe it's just the Darwin Awards process going on here. We will let the unvaccinated people kill each other off. Sorry, I think along those lines quite frequently of get these people out of my life. So anyway, thanks, Cindy.
Okay,
Hey,
thanks
Cindy,
for that, Bert.
this is-
So we will pivot to Emily and then Ashley.
If I unmute myself, I do well. First question, vaccination, any word on vaccinations for under 12?
I have not heard anything yet. I know that the studies are still ongoing, and from what I've heard, Pfizer is doing the largest studies for children under 12, but we have not yet gotten any kind of an estimate for when those vaccines will be available. We were really keeping our fingers crossed and hoping that it was going to happen before school started, but obviously we're not there yet.
Second question, with St. Pat's putting elective surgery or elective procedures on hold, I assume those are procedures that expect that expect a hospital stay. So it's like a total knee replacement or something like that versus a day procedure.
Yeah, I believe that is correct. I just know that they are experiencing staffing shortages, and in order to be able to give their staff some time off, they're needing to put some things on hold, but they're hoping that it's only going to be temporary, like for the next couple of weeks, and then be able to go back to offering those procedures. But my understanding is that it is primarily, they're still doing outpatient procedures, they're just not doing inpatient.
Great, thanks.
Thanks, Emily. Thanks, Cindy. Ashley?
Hi there. My question is about the booster shot. I think they came out today with saying 6 months instead of 8. Is there a plan for people who went through the health department to get their booster shot for what's going to happen then?
Yeah, so we actually still have our clinic. We're one of the only health departments in Montana that is still operating a specific COVID vaccination clinic. And so we are increasing our staffing there in anticipation of having people coming in to get boosters. And so as soon as the FDA clears that, then we are set to hit the ground running. And I think that what we're experiencing right now is that as people are seeing the increase in cases, we are getting some of the people that have been reluctant to get vaccinated coming in. And so there's talk at this point that we may have to go back to appointment only instead of doing walk-ins, because about half of our traffic has been walk-ins, and now it's starting to exceed our capacity. So I have a feeling that when we get ready to do boosters, it's going to be on an appointment basis. And that link is on our MissoulaInfo.com website to schedule those appointments. But yeah, we're just waiting for the FDA to give approval for it.
Perfect. Thank you.
Thanks, Ashley. Lee?
Hi, thank you. I just want to first say, Bert Caldwell, I agree with your comments. And second, I would like to say that as a community council, we are going to remain doing Zoom meetings and not meeting in person, probably for the duration of this complete season, as a result of those who are not being vaccinated and caring about the well-being of our communities. So in order to protect our community, we are meeting only through Zoom.
Yeah, and I will let you know that at the health department, we did implement the no in-person meetings, and actually this week, Deshane has instructed those of us who can work from home should work from home so that we can try and get fewer people in the building. And then everybody has to wear masks within the health department building. And so we are also at the health department taking additional precautions.
Good, thank you so much.
Thanks, Lee, for those comments. Bert?
Yeah, I got two more. One of them's kind of facetious. Is there anything that 702 is not in conflict with related to common sense? Okay, and I don't need an answer on that one. And the second one is there anything legal besides 702 that would keep a hospital or a doctor from saying, you didn't get vaccinated, go home. I'm not going to treat you.
I'm pretty sure that legally they cannot do that, even outside of House Bill 702.
Oh, that's one of my dreams.
Yeah, I suspect there are all manner of other bonehead things people do that doctors wish they did not have to attend to, but they do anyway. Other questions?
Yes, I have a quick question about, oh, sorry, can you hear me?
We can.
Okay, this is Juan. If you do an at-home test, say from, I'm forgetting the name, Biomax, or from CVS or Walgreens, and it's positive, are you supposed to come in and do a PCR test as well, or what's the protocol then after you take an at-home test? And
yeah, so we are recommending that if you take an at-home test and it's positive, that you come to our facility or go to a healthcare provider and get a PCR test for confirmation, particularly because the Binax tests that are widely available in drugstores have a high false negative and a high false positive rate. And so it's definitely important that you follow that up with a PCR test.
So, okay, even if it's negative, come in for a PCR test.
Yeah, if you're having symptoms and it comes back negative,
okay.
you still,
if you're having
you
symptoms,
still want
got
to.
it.
Yep.
Unless you really like
Okay.
things jammed up your nose, maybe you just go in for the PCR test. Okay. Other questions?
Thank you.
Thanks, Juan. Other questions? Okay, well, here we go again. Thanks, Cindy. Not the greatest of news, and unfortunately, it seems to be precipitated by folks who are recalcitrant here and not wanting to get vaccinated. So keep up the good work.
Thank you. Have a good night.
Thank you.
Thanks, Cindy.
All right, who's going to speak to board training?
I'm going to do the next two, actually, Commissioner. So I'll do the board training quickly. We do have a board training coming up September 14th, which is a Tuesday. It's 6 to 9, and it's with Dan Clark again. This particular training, we're going to be hosting hybrid. So we're going to be hosting it in the Sophie Moise room, and then we're also going to have that hybrid Teams option. We also are going to be recording it and posting it to the website. So if someone can't make it or has missed it, we'll put it up on the website after the training is done. I just received the board training materials this week from Dan, so I'll be sending out a reminder again next week with all of those details. For that, I see Lee, you have your hand up. Yeah.
Yeah, before we go to Lee, Kyla, so are you wanting folks to RSVP? Because I guess particularly under the circumstances, there's a limit to how many folks we're going to want in that Sophie Moise room.
Yes, that is correct. I'm working with the city. The city is technically hosting it, but I'm helping facilitate since it's in the Sophie Movies room. There's a capacity of about 30 in person for classroom setting for COVID. And we are keeping an RSVP list. We're about at 50% capacity at this time. If anything does change in the next 2 weeks where we have to cancel that in person, of course, we'll let you know and still try to host virtually. But for now, we are doing that RSVP list. So if you do plan on attending in person, let us know as soon as possible so we don't reach that capacity.
Thanks. Lee?
Kyla, I do want to let you know that that is the night of our board meeting that starts at 7. So I know that none of our board meetings will be able to attend, and I want to thank you for recording that. And if you could make that available to us, I'd really appreciate it, because I will see that all the members, including myself, get that and can go over that.
Yeah, of course. I think Lolo Community Council also has a conflict. The city kind of arranged this meeting, but I will send out email to every active board member so they have that link and those resources to view the recording at their own discretion if they're unable to attend.
What's the date on that?
September 14th. It's a Tuesday evening.
Okay, thanks.
Sure.
Richard? Oh, Richard, it looks like you're muted, perhaps. Try it again. Huh. Your lips are moving, but is anyone else hearing Richard? No?
Nope,
No.
no.
I'm switching. Oh, there we go. Oh, we lost you again. You're muted. Yep, try that. Looks like you've got a bad microphone or headset or something there, Richard. We lost you again. We had you briefly. And Mission Control cannot do anything to help you here. So try talking again. Okay. Well, Richard, hold that thought, and maybe things will come back to life, and you can join us, or put your question in the chat there if you want to just type it in. While Richard's doing that, other questions regarding board training? And if folks have not been through it, it is good. I would highly recommend either participating in the actual event or after the fact watching the recording. Dan Clark is good.
Somebody told me we were supposed to do this every year when it was available, whether we had been through it 6 times or not.
Yeah, that's what I
Or if
heard.
that is true, it's in the community council bylaws, depending on which bylaw version you're running off of. But a lot of the community councils do have that in their bylaws. But all of the, I think the last 3 trainings are online for viewing. We did one in April, and so that one's online right now.
Okay.
And generally, Dan is pretty good about modifying these on the fly. So if council members come with specific questions or issues that they're encountering, he'll adjust his presentation accordingly to make sure that your concerns are addressed. And it looks like we have lost Richard to a blurry background there, so maybe he'll come back at some point. All right, thanks, Kyla. You want to carry on?
Yeah, it looks like we may have actually answered his question. It looks like he had a similar question to Bert. The next thing that I was just going to go over, I'm kind of filling in for Lori Hire with CAPS. Just doing a quick review of that bylaw template for the community councils. If you all remember, in April, the new bylaw template was approved by the commissioners that allows some of those updates. At the end of May, each chair of the council should have received a new copy of that template. And then there's just a little bit of a process that we wanted to kind of go over briefly, just so every council is understanding kind of the process for the new how to adopt the new bylaws. So first, the council has to review the template and insert your name in the appropriate spots, which are underlined in the template. After you've made your adjustments, if you want to add alternates or not, depending on what your council has made agreements on. And then once you come to an agreement as a council, all council members sign the bylaws, and it could happen at the same meeting or an additional meeting, depending on what type of changes you may have. Then that new version that's signed by the council goes to the CAPS office. CAPS staff do a review. If there's any changes or questions, they'll reach out to the chair of the council. If everything looks fine with the bylaws will then go to the commissioners in their administrative meeting for approval and signatures. And then once CAP staff has received that signed copy of the bylaws, it'll go to the clerk and recorder's office to be recorded. There's a few other steps to getting alternates seated on the council. So first, the bylaws need to be approved before any alternates can be assigned. So the bylaws have to go through all of that process, get the signatures from the commissioners, be recorded by the clerk and recorder's office. Once that step is complete, we can then go to advertising terms, which is a media release for 30 days. And then the applicants can apply during those 30 days, and they follow the same guidelines as regular members of the council. And then as far as that goes, as far as appointing those alternate positions, it is to the next election cycle. So they're only appointed to that next election cycle. As soon as the next election cycle is termed, they will have to go through that same process as any other council member has to. I think you guys probably know all the background on this, but the original template was created in 2008. There hasn't been an update since. Over time, individual councils have revised and updated their own bylaws based on their needs. Staff from CAPS and the Commissioner's Office have worked together to identify some of the overlapping needs the councils have brought forth to our attention. And some of the things that were included and made changes on this template was the removal of term limits, the options for councils to have alternate positions, electronic communications do's and don'ts, and funding management were some of the big changes on this new template. That was just my brief overview. I see there's some questions.
Thanks,
Bert?
Kyla. Yeah, Bert and then Lee.
Yeah, I've got two quick questions. One is, well, actually not a question. You left out the part where the template was changed because of some outrageous request for bylaws updates by a particular council. And and the other one is, where are my bylaws? I turned them in with all signatures a while back, and I would like to go forward with this. Any ideas?
I don't know. I'm assuming you turned them into the CAPS office.
Yep.
Chuck
just check
Krauser, I see you out there. Do you have any insight?
Bert, hey, I'm not sure. I would have assumed that we would have gotten those turned around. I'll check on that tomorrow and I'll be in touch.
I appreciate it. Thank you. That's all I've got.
Okay. Lee.
You just said that our alternates won't be eligible to serve until the next election cycle?
Depending on the process of your bylaws, as soon as they're filed with the clerk and recorder's office and they're approved bylaws, we can advertise for those alternates. If an alternate was to be seated, they'd be seated until the next election cycle. So it would just be a partial term. And then once that election cycle was up, they would go through the election process just like every other council member.
Okay, are we limited to one alternate or can we have two if we choose to have two?
There is the option to have one or two, depending on what your council decides.
Okay, perfect.
Thanks, Lee.
That
Other
answers my
questions?
question. Thank you very much.
Thanks. Other questions regarding bylaws? Who does not like revising bylaws? I just cannot get enough of it.
You're on your own.
Okay. All right, if there are no further questions on bylaws, I think it might be that time in these meetings when we just do a round robin of the community councils that are represented to give us a little update on what they have been up to in their particular geographic region. So I will take the prerogative, since I am seeing the faces of the Bonner Milltown Community Council on the line here. Give us an update, any of you.
Go ahead, Emily. Say what you got to say.
We took the month off and are enjoying it.
On your back porch. Well, yes.
Absolutely, because there's no smoke, or well, little smoke, but manageable. No, nothing new here.
Now, one of the biggest things going on right now is the Bonner Mill repository removal, and they are down to the ground, but I'm still kind of flabbergasted. I had a meeting earlier today on that, and the original contract was to remove 60,000 tons with a contingency up to 70,000 tons. So far, they've removed 86,000 tons. I had questions, and I still have questions as to how, with DEQ being on top of what went into the repository, an engineer couldn't get closer than 30% to what was going to be removed. But the fact is, it's pretty much gone. They've got to do some cleanup with what was the concrete foundation that they knew about that was under it. And we're going forward, and it looks like the TIF is pretty much going to cover it. So not done, but almost. That's all I've got.
Thanks, Bert. And it looks like the progress is coming right along on the fire station out there.
Oh, yeah. Yeah. You can't even go over there on Saturdays and walk through it anymore. They got doors and stuff.
Richard?
Can I be heard now?
Yay.
Hey, I'm here. I'm a full human being now. Well, I went to the planning and zoning outreach for the new new ordinances, and brought that back to our commission. It's very interesting. I didn't realize so much of the county wasn't zoned at all. I think they're heading in a great direction in terms of having open land zoning classifications and agricultural preserves. Pretty interesting. I also kind of have a bone to pick with Mountain Line. They're going to be coming and visiting and talking to us about expanding the 4 route to Bonner Milltown. But we have an issue out here, at least in West Riverside, where we have absolutely no bus stops designated. You don't know where they are. There's no signs. And in speaking to Mountain Line, they've told me that that's because the county is against signs, and it's much easier to get them in the city. And I said, I know the commissioners. It's funny you mentioned that. I happen to be on BMCC, and I don't believe that they are not fully supportive of public transportation. So that's an issue for us out here. They do not have. They had a contract to upgrade bus stops and signs in the city, and that contractor went bankrupt. And so they're putting it out for bid again. But we have no signs anywhere in West Riverside. And in fact, I've tried twice to take the bus to Kettle House. The first time it didn't arrive within a half an hour. The second time it didn't arrive within a half an hour. The first time it blew right past us and waved to my 68-year-old sister and I, even though we were standing in what was supposed to be a designated bus stop. So I don't know if it's a personal thing. I'd be happy to talk to the commissioners about it. I don't think that's the case.
Richard, as luck would have it, 2 of the commissioners are on the line here. So Juanita, what do you think? Are you good with bus stop signs? Geez, we lost one of the commissioners. So I think it's safe to say, Richard, that if you have further conversations with Mountain Line and they are alleging that the county's opposed to signage related to bus stops. Maybe they need to come and have a conversation with us because I have no recollection of any such directive from the county.
As it
Yes,
happens,
we support bus stops. And
Okay, there we
we can also
go.
check in.
There we
Something
go.
happened
Much
here.
easier.
But yes, we should check in with Mountain Lion as well.
as it happens, Rick, I have a lunch appointment with a member of the Mountain Lion Board Friday. Send me a note with all your concerns and thoughts, and I don't care if it rambles or whatever. She's going to hear it.
Great.
Okay, I will wait until after she finishes eating.
Well, and I knew the commissioners were fully in support. Much easier to increase ridership when we know where to catch the bus at.
Right, and we'll get
Absolutely.
Mountain Lion. We'll work with Mountain Lion and the commissioners, and I'm sure since we finally got signs on Tamarack Road saying no parking, I'm sure we can get bus signs.
Thank you.
I mean, usually we're trying to be more arbitrary and capricious than that, but we'll make an exception for you guys. We'll get you a bus sign. So
Yeah, I thought that was kind of funny. He said it's very easy to do in Missoula, but the county, it's real difficult. And I'm like, we don't even have sidewalks. How hard is it to put a sign up?
Send me a note, Rick.
all
Thank
right.
you.
Yeah, just okay. Yeah, thanks for that intel. I appreciate that. Okay, but that was Bonner Milltown. How about East Missoula, Lee?
Well, I pretty much announced that we're still going to maintain our Zoom meetings, and that's the only real big announcement, other than the fact that I actually have 2 alternates wanting to come on board, and we need them because I'm kind of missing a member of our regular council, so replacement alternates would be great to have on hand to help us be sure of a quorum. And I think I agree with you guys on the zoning update. We had our little open house out here in East Missoula as well. That was very successful. The wind wasn't blowing, which was amazing. I don't know how that happened, but none of the signs really blew over while I was there. So it was very well conducted, and I appreciate them putting that on for the citizens of our community to be able to attend that and see what we're doing. That's
Great.
really all I have.
Thanks, Lee. And I'll just open it up. Do we have anyone from Lolo or West Valley?
Hey, this is Ashley. I'm from Lolo, but it was just my first meeting last month. So I'm just kind of getting into the swing of it. And it seemed like not too many majorly pressing issues, but they're talking about coming up with marketing their meeting so more people from the public come.
Well, great. We look forward to hearing what y'all come up with. I think that's a standard problem or challenge for most community councils, is keeping folks engaged and interested when there isn't some full-blown controversy going on that brings out the pitchforks at meetings. So thanks, Ashley. Is there anyone from, I don't think there is, but anyone out there that we've missed from either the Swan or Sealy Lake Community Councils, or let's just throw it in there for kicks, Evero? No takers. Enjoying the last vestiges of summer here before fall sets in. How about Chet, Chris, Emmy, do you guys have anything from the county side to share with folks? No? Juanita, anything you want to leave with the group?
No, I don't want to get between folks and their dinner. So thank you all. And I'm wondering if there's notes, like brief notes taken from these meetings that we could share with community councils that weren't able to attend, especially when we have good information about COVID or Wildfire or Smart 911, if there's a way we can update.
I believe that does happen after each meeting. Kyla, you want to confirm that?
Sure. After every meeting, I do a follow-up with a YouTube link from the recording and any pertinent reference material that has been presented to all the council members, not just whoever
Okay.
attended.
Great, you're the best, and apologies that I didn't already know that. Thank you.
Okay.
And I know we repost ours onto our Facebook page and stuff like that. So
Great. Okay, thanks, Emily.
Any last words from anyone? All right. Well, as always, thank you all and be safe out there. And we look forward to connecting again in September.
And as always,
everyone.
thank you, commissioners, for holding these meetings.
Absolutely.
Even though there are only two councils showing, well, three now showing up,
Great.
it's important. It really is.
It is. I agree.
The best ones are always
Yeah.
here.